Potty training can be challenging for children with disabilities. Most of them learn to urinate and have bowel movements in the toilet later than other children. Each child is different. Children with disabilities have common problems that can make toileting hard. Knowing about these problems can help you come up with different ways to meet your child's needs. Here are some ideas to think about. Physical. There may be a physical or medical reason for toileting difficulties. Discuss these issues with your child's pediatrician. Language. Some children with disabilities may have trouble understanding and using vocal language. Dressing. Some children with disabilities may have difficulty pulling their underwear and/or pants down or pulling them back up. Fears. Some children with disabilities are afraid of sitting on toilet seats or hearing toilets flush. Getting used to the toilet by using a visual schedule and making it part of the routine can make it less scary. Body cues. Some children with disabilities may not be aware that they need to go or that their clothes are wet or soiled. The need for sameness or routine. Many children with disabilities already have their own ways of urinating and having bowel movements. Learning new ways to toilet might be hard. Using different toilets. Some children with disabilities learn a toileting routine at home or school, but have a hard time going in other places such as public restrooms. There's always something a child with a disability can do to become more independent in toileting. Just remember that toilet training tips for typically developing children often need to be modified for children with a disability. So, where do you start? Trip training, or schedule training, helps children learn toileting skills without placing other demands on them. You can set the schedule and help train the child's body to follow the schedule. Sit for 6. Set a goal for 6 toilet sits per day. At first, trips will be short, as little as 5 seconds per trip, with one longer trip each day to work on bowel movements. Over time, sits can be longer, up to 10 minutes. Setting a timer can be a helpful way to let your child know when the toilet sit can end. Your child is also allowed to get up from the toilet immediately if he or she urinates or has a bowel movement. Boys are taught to sit on the toilet to urinate until they regularly have bowel movements on the toilet. Don't ask. Tell. Don't wait for children to tell you they need to use the bathroom or to say yes when asked if they need to go. Tell them it's time for a toilet trip. Schedule. Make toilet trips part of your everyday life. Plan toilet trips around your usual routine. Stick with the same times of the day or the same daily activities. Communicate. Use the same simple words, signs, or pictures during each trip. This helps the child learn a toileting language. Keep trying. They say it takes 3 weeks to make a habit. Once you outline the routine and methods, keep working towards the same goal for 3 weeks. Make a visual schedule. Pictures may help your child know what to expect during toilet trips. Take pictures of items in your bathroom, like the toilet or toilet paper. Place these pictures in order on a piece of paper to show your child each step of the toilet trip. There are also websites with toileting pictures that you can print out. If your child does not yet understand pictures, you may need to show your child actual objects, like a roll of toilet paper, for each step. Identify rewards. Make a list of your child's favorite things, like foods, toys, and videos. Think of which ones will be the easiest to give your child as soon as he or she urinates or has a bowel movement in the toilet. A small food item, like a fruit snack, a cracker, or a chocolate chip, often works well. In addition to giving a reward for going in the toilet, you can also give your child time to do a favorite activity, like watch a video or play with a toy, after the trip is over.